I'm going to start this lecture because a major topic has been left into this, and you people are, going to have your exams so very soon. So that's why I'm not going to delay anymore. Okay. So earlier we have studied what is the responsibility when we are transferring any patient, what all things we need to keep into mind when we are hiring any staff, everything basic related to, I can say ki till right now, we have a rough idea related to the duties and responsibilities and the procedures, how the everything should be interrelated till once a moment where the patient is hospitalized or getting admitted into emergency or into the ward until the discharge, what is the job responsibilities of being a part of that hospital. Okay, so I have explained I have given a picture of everything till now. Now coming to the nurses, who is going to play a very important role into the overall management of a patient. Okay, doctors are one who is treating, prescribing the medications and everything, but these nurses are the one who is exactly following those instructions and giving the best care to the patient. Okay, so majorly if I talk about after the doctors, the paramedical staff, they will play a very important role in overall growth development or the prognosis of a patient. Okay, so coming to what is the exact qualities or the responsibilities of a nurses. So as you know, in nurses we say ki, the healthcare services are always selfless services and more focus on the dedication and devotions, okay, towards their patient, towards their profession. This is something whether you are a working doctor or you are a paramedical staff. In cases of emergency, we need to extend our shift and provide the best care to our patients, okay, as per the need. Okay, so basic thing, if I talk about related to a nursing care, is your devotion, your full devotion, your care should be required by your patient. Other than this, being when you are working with a hospital, overall personality of that particular patient, she needs empathetic presence of yours, or one-on-one I can say one-on-one individual attention seekers those people are, or they require maybe. So depending upon the different criterias, okay, then what are approach being a nurse, what is my approach? So my approach should be कि as per for a requirement the patient wants my empathetic presence, or I should respect their empathetic presence of their religion, everything. Okay, so same manner my approach when taking care of my patient should be a holistic means overall approach. I should full approach. I should extend my broad mind working technologies and try to help my patients, whether they need a emotional support, whether they need a psychological support, whether they need a physical rehabilitation, whatever, or the medicines, whatever is required to cure that patient. Being a paramedical staff, being a nursing staff, it is my prime responsibility to deliver those services to my patient in order to cure them. Okay, so providing counselings, providing physiotherapies, providing psychosocial needs and medicine so that the patient can cope up with their disease condition. Okay, next is, if I talk about is your advocacy and support is another important thing. So if I talk about this your elite patients, they require your full support. Okay, uh, once you are working as a paramedical staff into any hospital, okay, or elite health science services, you need to adapt accordingly. You need to work with a patient, you devote yourself, collaborate or with a different teams, like you're taking a patient from accident site to the hospital, from hospital to different departments. So That is how you should be there every step. Otherwise, patient will feel insecure. So till the moment he's stabilized or he's given care of a next person and he's not okay, till that time we should try to provide the support. Okay, whatever the barriers may be during working into the scenarios. Okay, if the multiple department or hospitals are involved, you will definitely face a different challenges, different barriers, but being a healthcare professionals, we try to overcome on those barriers and challenges and try to help our patient at the best wherever we can. Try to help them, or whatever is in our hands, we try to help them to achieve the best health services. Okay, next is, and most important thing, being a paramedical staff or being a medical staff, because this branch of medicine or this branch of science is in state of continuous growth. So for example, earlier those technologies which we are working on 10 years back, now we have a modified versions or more advanced technologies which we are working on them. So time to time trainings of these medical staffs and paramedical staffs and their updated knowledge should be very important. Meanwhile, not only the knowledge, they should polish their skills also. Okay, so their skills should be very fine and up to date to perform all the procedures. Okay, so being a head or the administrative department as per the need of the community or the disease condition into that particular area, we need to provide the trainings and mentorship to our paramedical and medical staff so they can do the advancements. Okay, earlier for example, I will talk to you like we have a mastectomy. Okay, mastectomy is related to your breast cancer. The female who is having a breast cancer, we dissect their breast or dissect the part which is infected with or carrying the oncogenic cells, cancer causing cells. We just remove those parts, and what we will do, we will just leave them. But nowadays we will do the breast implant. So artificial breast will be implanted into these patients, so the physiology of the body or the appearance of the body should not be hampered. Okay, and the regular examination should be done so we can check there is any kind of reoccurrence or not. So you can see earlier only 10 years back we do only mastectomy, we just dissect and do the chemo or radio whatever is required. But nowadays implants are there and we are using into these patients, so the appearance, the physical appearance should be maintained. Okay, now cultivating and healing environment, why the patient is coming to the hospital to get cured. So the nature aura of the art staffs or their nature should be more like curing the people. When they talk whatever the state of mind, they will feel more relaxed, more trust. They can gain the trust from those staff, and the environment they provide should be healing kind of environment. Okay, to their patients, so it will promote the prognosis, good prognosis, and healing of the patient will also getting faster. Okay, by providing a safe environment, clean environment, and doing their work on time. Okay, next part is embracing and privilege of caregiving. So above all, the nurse care should be a full devotion, deep sense of purpose, and service to others. Okay, so medical field, I already tell you in the starting of today's lecture the we should be more dedicated to the people. Okay, for us duty calls are on top priority in order to save our patient. This is what we take oath when we are studying or passing out. Okay, so that is our Hippocratic oath, where we already taken this oath. Patient life should be at most important, should be always required into this I can say profession. So more gratitude, more devotion, more service towards the community, towards the patient, or towards the others. This should be the basic ethics of this particular job profile. Okay, and being a nurse, you should fulfill and make the positive changes into their life of their patients,
and their family members. Okay, so these are the basic responsibilities of the nursing care. Okay, which we will when we are hiring any nurse, we try to look all these things into them. Okay, so now, though there is a dedication and devotion, the nurses inspire the hope, instill courage, and bring the healing to those in need, and they're leaving a lasting legacy in the compassion and care in their hearts of their patients. So I told you, whatever your actions will be, it will create an impact into your patient's life. So they will create a very soft corner for you, or a gratitude for you, or long lasting impression of yours and your caregiving nature or nurture into their hearts. Okay, so nursing cares what they delivered. They delivered high quality of care, dedications to their patient, and professionalism is the most important thing, along with in-depth knowledge of their patient and know when and what things should be prioritized to cure that particular patient. Okay, second thing if I talk about is your reliable and consistent care. So nurses who are committed to their practice prioritize the consistency and reliability into delivering the care to their patients. Third thing is the patient safety and advocacy. Again, it is a very important thing. Next is continuous importance and improvement and learning, that I told you like every 5 years, every 6 years, or every 2 years, we have certain new advancements into different branches of medical science. So with time to time we need to update our knowledge, we need to update our technology, so we can get more accurate results, and healing will be faster and in the different kind of patient, depending upon what is the line of treatment and which suits the best to the patient. On the basis of that we will do. Okay, effective communication and collaboration, again very important thing ki if you are effective, if you are able to communicate your words, communicate your things to your patient very clearly without any failure to the patient as well as their family members, so you already win the 50% of your fight towards the disease condition, because delivering your knowledge to your patient and delivering the correct instructions to your patient is very important, and your family members. So committed nurse prioritize the open, honest, and transparent communication, and ensuring the patients are informed and engaged and involved in their care decisions. So why we are doing that? So if the communication is clear, so patient can understand their state of their disease condition, and they will try to follow the instruction of the patient, or do the proper care, or the assistants, or the family members of that particular patient also understand and try to follow those instruction, or cooperate with the this nurse to provide the best facilities. Okay, next is compassionate and empathetic care. Again, it's very important towards the patient as well as the family member, and at the same time it is very important to have a kindness, being a medical staff, gratitude, respect, dignity towards the humanity, or towards the community, human community. Next is ethics, practice, and integrity. Being a medical professionals, we have certain ethics, what to do, what not to do as per the morals. So same thing for our personal benefit, one of the most important thing into the medical sciences, for our personal benefit, we should not try to cheat the patient. Okay, our communication, our decisions, our treatment should be clear to patient, and that should be for the benefit of the patient. Okay, So these nurses adhere to their principal code of ethics and legal regulations and governing nursing practices, ensuring that their actions are guided by honesty, integrity, and accountability. So these people are again very responsible for their patient's life and their condition. So they need to take proper care. Last is leadership advocacy. So again, the committed nurse should be leader and advocate their professionals and their patient and the uh, broader healthcare community. And they should, whatever, if I talk about leadership and advocacy, means for my patient, me myself is responsible as a doctor. Same thing happens for these nurses. Okay, if they are dedicated, they should take the leadership of that particular patient, or they should take, yes, I'm the responsible if I feel to provide the good care. So leadership is very important when we talk about the nurses. Okay, so the committed nurses also advocate the healthcare policy challenges, the social justice and health equality, striving to improve and assess the quality and care of all individuals and community. Okay, now we have just studied the roles and responsibilities of the nurses and nursing centers. So overall, I can say a nurse should be professional, should be, follow the code of conduct, ethics, reliability, accountability, excellence, safety, continuous improvement, and effective communication, compassionate, integrity, leadership, advocacy, and meanwhile, the most important thing is selfless care to others. They should do that. Okay. So these are the basic, I can say, overall responsibilities of the nursing to take care of the patient. Next part is your diagnostic services. So as name indicates, the diagnostic means those tests of or those types of services which is based on your signs and symptoms or differential diagnosis to get a final condition and make a decision. Okay, what is the exact disease condition or what is the exact disease from which our patient is suffering based on the sign and symptoms. So to why we need a diagnostics, first to make a decision, okay, what is the exact disease from which this patient is suffering. Second, once we are aware of the disease condition, we are going to check for the growth of the patient. Okay, these particular diagnostic services are going to help our patients or not. Okay, so diagnostic testings involves the analysis of the biological samples such as different types of markers we are going to check, like blood, urine, tissue, genetic material, and specific markers into the blood samples we will check. Okay, so if I talk about blood samples, what all things we check into the blood sample? We'll check CBC, total blood count, WBC, blood chemistry, or blood chemistry panels. You can say LFT, KFT, all those things. Okay, urine analysis, again, what is the color of urine, any pus, any infection, all those things we are going to check. Microbiological study. Okay, so diagnostic tests are first category where we are going to check all those tests to make a decision. Okay, either what is the disease condition or second, what is the prognosis of those particular disease. Okay, if it is a established case or disease is already known to us and treatment is going on. Okay, next part is your imaging studies. Imaging studies, as name indicate, we are going to create the exact image inside the body. So whatever may be the condition of that particular region, we are going to create a exact image by using different methods such as X-ray, CT, MRI, ultrasound. nuclear detecting tests. All these tests has to be done, okay, to study the exact image inside the body, whether it is a soft tissue, whether it is a hard tissue, whether it is a nervous tissue, all those things. Okay. Next is your pathology services. Pathology services involves the examination of tissue samples. For example, I feel that this patient is having a kind of neoplasm. Okay, what we will do, or any kind of disease condition or cancer, we will try to get the samples from that particular area or the tissue from that particular area, and now this tissue will be used as a biopsy, and we study all the cells inside under the microscope by using different type of stains and everything, and on the basis of that we just study the nature of a cell, ki what kind of cell, what is the size, shape, and whether these cells are regular, irregular. Okay, what are the cellular abnormalities present into that. On the basis of those things we will decide the pathology of the patient, ki what is the exact pathological condition and what is the treatment, best treatment plan for this particular patient. So pathological services are somewhat involving the examination of the tissue sample and trying to help us to get more clear picture of that particular disease condition. So it is one of the advanced tests. Next is your functional and physiological tests. For example, functional means we are going to study the function of a particular body organ or a system, ECG. Take an example where we are going to study the heart functioning, पूरा एक cardiac cycle. Cardiac cycle, if I talk about, that means कि the moment blood is coming or getting collected into this superior vena cava to the right atrium to ventricle, then it is going to your lungs, from lungs again it is coming to your right left atrium, then ventricle, and it is going to circulate to the rest of the body through aorta. So this whole cycle collection from superior vena cava to again exit from this, so this is known as cardiac cycle. So we are going to study the whole cardiac cycle through this ECG. So if there is any abnormality, it will be seen, and we will able to know what is the exact cardiac status of a body, whether that heart is functioning properly or not. Okay. So these type of test is known as functional and physiological testing. Okay, where we are going to assess the function key, whether the physiologically that particular organ or system is functioning properly or not. Okay, so again we have, I told you, one is your ECG. Okay, electroencephalogram, we usually do it from brain activity, EEG called it as. Okay, electromyography is for muscles functioning. Okay, so these types of tests such as respiratory disorder, cardiac disease condition, neurological musculoskeletal condition, all these conditions related to the abnormalities or dysfunctioning of any system can be identified by these particular tests. Okay, next is the point of care testing. Point of care testing, if I talk about, is a diagnostic test performed at the near patient bedside. Okay, we usually do in the serious conditions where patient cannot be moved. Okay, and devices are portable and easy to use and require the minimal sample volumes. So, for example, influenza test will be there, glucose monitoring should be there, urine dipstick test, and pregnancy or urine tract infection. So, these are the point of care. As the name indicates, why we are doing to check the status of a disease condition or to check the uh, what kind of care is given, is there any improvement or not, so we can make the clinical decisions easily. Okay, next is the genomic or precision medicine. Genomic or precision medicine is which involves the DNA to RNA changes, or what kind of medication is going to affect our DNA and what is the impact of that particular medicines to our genomes, okay, or genes. That is all these kind of tests will be or studies will be done under genomic studies. And lastly, we have a telemedicine. As the name indicates, tele means telephone. So diagnostic leverages and the digital technologies. Now, nowadays, in order to save the time and everything, we are using telecommunications to make the things easier and faster. Okay, and it will be very easy for a doctor to keep an eye on their patient records and reports and their health status. Okay, so telecommunication is again very important treatment aspect now nowadays. Okay, next, if I talk about a major important thing is your blood transfusion services. Anyone can tell me what is blood transfusion? So if I talk about blood transfusion as name indicate ki blood is given or transfused into the human body from external sources. So the blood and blood related products. So blood related products, if I talk about, is your RBC, WBC, platelets, and so these are the different types of blood product which we are going to provide to our patient depending upon the need. So the blood transfusion services essential components of the healthcare services and provided all over the world and life-saving blood products to the patient in need. So whosoever patient's requirement of their body or if they need it, we will do the blood transfusion into the patients or these disease conditions. So what all things we need to do before taking or doing a blood transfusion, we need to check the blood group of the patient as well as the donor, the one who is donating their blood to that particular patient. After checking the blood group, we will check the RH factor, whether it is a positive or negative. Once they match, then we will follow the blood transfusion procedures. Okay. So the blood collecting and donation, the blood transfusion services rely onto the voluntary blood donor who generously donate the blood and meets the demand of the blood product to the for that particular patient. Okay. So we have a blood donation drivers, mobile blood donation unit, and a fixed blood donation unit centers operated by blood bank and transfusion services, which includes the assessment of the medical history, vital signs, and hemoglobin levels. On the basis of that, we will accept the donors. If they are not suffering from any disease condition, their hemoglobin should be uh, above 12 or 30 milligram per day, and they are not carrier of certain disease. Okay, on the basis of that, once history and everything, once we find the patient is okay, then we will take the blood. Next is the processing and the component separation. The processing involves the blood um, components. I already told you we had a WBC, we have a RBC, we have plasma or platelets. So there are different components into the various components into the blood. The first one is blood cells. Okay, next one is plasma, platelets, plasma, and cryo precipitation. So these are the different components from which we separate the blood and different parts, different components of the blood, and try to transfuse it into the patient so we can get the maximum benefit. Okay. So patient with the anemia, for example, I will told you, the patient is suffering from anemia or severe anemia or moderate anemia, and they required a blood transfusion. So in those cases, patient may be benefit from the platelet or this plasma transfusion. Okay, so we will provide the same. Okay, so as per the requirement of the body, we provide that. Okay, again, in cases of typhoid or where fever where the platelet count is going down, in those cases also we provide the uh, platelet blood platelet to the patient. Next is the blood testing and screening. So the first, prior to giving a blood to any patient, we will go for blood cross matching. Okay, and there we perform certain tests to check the blood group and RH factor of the patient. Once everything is falling into the compatibility level, then only we can proceed for the blood transfusion. So here we will check the compatibility of the donor and receivers, and including what all things we will, I told you ki we will check the donor should not be the carrier of any disease condition. For example, HIV, hepatitis B, C, syphilis, and human T lymphatic virus. Okay, HTLV. So these are the basic blood test screenings which we do prior to the blood transfusions for the donor, one who is going to donate the blood. So cross matching and compatibility has been done. Now transfusion and administration and monitoring. So when we are transfusing the blood to the patient, if everything is okay after the cross matching, we will check the transfusion state. Okay, and slowly try to transfuse the blood. Okay, so the blood transfusions are administered by the trained healthcare professional following established protocols and safety guidelines, and transfusion receipts are closely monitored for science services. Okay, so government will play important role for all these things. Next is your adverse event reporting and quality assurance. So, for example, the blood transfusion system in place for reporting investigation events associated with transfusion includes the reaction. Because whenever we are trying to give any new organ or transfusion, so body will act as those cells which we are giving to the body or implanting the body as an external source or external foreign body and try to react accordingly, try to generate the antibodies or macrophages to kill those cells. Okay, so because the body will not able to understand the differentiation. Okay, so the rejections or the reactions may be possible in cases of blood transfusion. Next is coming to your housekeeping services. Next part, important part is housekeeping services or the boys which are available to clean your rooms. And so, what is the purpose of these housekeeping? First of all, is to clean the environment. Okay, make sure ki in hospital a lot of viruses, communicable, non-communicable, everything was there. So these people play important role and clean the hospital, try to dispose the every waste product, try to sanitize the hospital so the viruses and disease condition cannot be spread from one patient to another. Okay, clear? Next part is infection control measures. Infection control measures means कि hospital का we should go for disinfectant solutions or fumigation or to kill the broad spectrum band of pathogens. Okay, and we go through the terminal cleaning procedures from room to room or once the patient is discharged by this method. So depending upon our convenience, we follow the pattern of cleaning. How we are going to clean. Okay, we are going to fumigate, we are going to manually clean, we are using the automatic robotics to clean. So depending upon the needs. Next is your waste management. So the waste management means we are going to try to manage the waste or dispose. And the waste segregating the healthcare waste into the categories. So as per the protocol, if you see into the hospitals, injection should be first burned or cut it and then disposed. All these things should be followed. So we cannot spread the disease to other people if the wastes are properly disposed, okay, into the hospital. So patient comfort and satisfaction also play important role for because of these housekeeping, because the housekeeping services contribute to the patient comfort and the satisfaction, paying the attention and detail in cleaning the patient's room areas and respecting the privacy and promote the adverse house addressing the housekeeping related issues or concerns revised by the patient or their families. So again, the you can see the housekeeping play a very important role because they are going to clean the environment, they are going to properly dispose hospital stuff. Okay, so again, if something is not clean, these people will be responsible, especially your washrooms, your room, or your floors. Okay, now coming to the quality assurance and monitoring. So if I talk about quality assurance and monitoring, means the regular inspection should be done, okay, and conducting the regular inspection, home making the housekeeping practices easier and cleaning standards higher. Okay, so these are the basic importance of quality. If you maintain a good quality of cleaning services or environmental services, definitely the job for you or the position for your hospital implementation of quality will be much more easier if you are following a good practical ethics. Okay, so housekeeping play an important role. Why? They clean the environment, first of all thing, they prevent the infection, second upon thing, maintaining an image. So hospital can have a sympathetic impact on the quality provided by them or cleanliness maintained by them by the organization. There are several hospitals where we don't want to go. Why? Because they are not clean, they are not so hygienic. So if the hospital and organization is not clean, not hygienic, it will create a negative impact on the patient. Okay, then again, if you had a good nursing staff as well as this housekeeping staff, so the improving the patient comfort. Okay, their anxiety reduce because of cleanliness and comfortable environment. So again, they play an important role. Lastly, ensuring the patient safety. So in this we are going to check whether our patient is safe or not. Next is cleaning and maintaining the services within the hospital setting. So again, if whatever that I told you, we need to improve, clean the environment, we need to clean our hospitals, we need to have a good quality of housekeeping, so the infections of the disease condition cannot be spread, communicable disease condition. So proper sanitization should be done or the by these housekeeping. So the good cleaning practices are very important, and to meet the standards of a people or their requirements. So housekeeping play an important role in maintaining the hygiene, cleanliness, and preventing the different disease condition. And query of care is provided and creating the sense of trustful confidence in the hospital. So with this we completed our basic responsibilities of ward boy of hospital, transfusion and administration part. Okay, so basically we discuss what is the responsibilities of these ward boys and how they are going to have an impact on a patient life. But again, if we are hiring anyone, maybe that person is not trained to sanitize any hospital or clean a hospital. So in these scenarios, what we are going to do, basically we are going to train them. So training should be very important, key how we are going to handle this particular cleaning equipment, what is the ratio of disinfectant, when and which kind of disinfectant should be used, what kind of biomedical waste should be disposed, and what is the exact method of disposing those particular products. So we always try to make them to understand their training. Again, as per the area of the hospital, we should increase their numbers, so they should not be feel as workload or everything. And again, they should ensure us uh, to clean that particular area which is assigned to them. So again, they play a very important role in maintaining the standards, cleanliness, and environment of an hospital. Okay, so training, if they are feeling somewhere, it's hospital responsibility to train their these paramedical or housekeeping staff so they can deliver the services on their top. Okay, so there are the different cleaning methods, where you can see I already explained you, like there are 2 to 3 methods. One is just we do by dry. So dry means ki you just use your broom or jharu and clean it. Second is we use different types of disinfectant solutions and surfactants. So again, we use water and mop and disinfectant along with a scrubbers and we put that solution along with surfactant. Then we have a scrubber that will scrub the whole floor. Then we have wiper that will wipe the water, and thirdly we have a mop. So we will mop, so if anything is left, the floor will be not wet. So these are the different methods, which cleaning methods which we follow. Just go through. If you had any doubt, let me know. Okay, so with this we done with our housekeeping. Also, next we have a cafeteria and dietary. So again, in hospital, the cafeteria and dietary play important role, because sometimes the patient and their family members are going to consume the food from that particular cafeteria and dietary sources. So whatever the food is available into the cafeteria, it should be nutritious, it should hygienic, it should maintain the proper nutritional values of that particular food or met the demand of the patient. Okay, so the cafeteria dietary services for the patient care individual dietary plan. Before meal preparation begins, the patient undergo the comprehensive dietary assessment conducted by the healthcare professionals, and on the basis of that, they are going to provide the diet to the patient. Okay, different dietary products to the patient. Okay, next is your menu development and meal preparation. So in case of culinary staff and collaborate the closely with the dietitian and healthcare providers to develop the menus of the patient dietary. For example, the patient, as per the diet of the patient, we do the changes and we provide the particular food to the patient, whatever is recommended by the hospital. So again, if I talk about diet play an important role. Nextly is the timely of the meal delivery. For example, we have given the breakfast at 6:30 a.m. So it our prime responsibility to provide the lunch by 12 or 1 p.m. And in between we need to provide certain juices or certain branch category of things, like branch of category of things, so the patient is not feeling a hungry or empty stomach. So the time and timely meal delivery should be very important. So the biological clock of the patient should be maintained, and nutritional value should be received by the patient when they're hungry. Next is patient-centered dining environment. So the hospital dining seems to be designed to create a welcoming and comfortable atmosphere for the patient to enjoy their meals, including providing the accessible sitting options and positive experiences by prioritizing the patient comforts and satisfactions. The cafeteria and dietary services contribute to promoting the sense and well-being and dignity of the patient during their hospital stay. So again, if I talk about related to the patient care, three more things important as first is your individual diet plan, second is menu development and meal preparation, third is timing, and last important thing is whatever the dinner we should provide, it should be as per the patient taste, and same time the nutritional value should be maintained. If it is so, it will create a fast healing or promote the healing of the patient. Okay. Nutritional education counseling is very important, okay, for the chronic condition, and these education should be given to the patient about their dietary choices and during their hospitals stay and when they are discharged also. So I explained you certain lifestyle cases to you people, so what kind of lifestyle we are living and how diet can be going to have a great impact on those lifestyle things. So same thing happens whenever any critical conditions are there and we are restricting certain things. We are going to explain those conditions to the patient and how that particular thing is going to impact on a patient for a very longer run of time. Okay, or in longer duration of time. So the importance and functions of the hospital dietary services are to deliver the best quality of food to the patient at the reasonable cost. Okay, establishing the policies and plans the layout. Third is purchasing the raw material that requires for the food and checking their quality, quantity, and storage and food preparation. Next is educating the and counseling of both inpatient and outpatient on specific dietary problems before the discharge. Proper planning and menu as per the patient preference. There should be varieties of the food choices available to them. Training the dietitians and interns and educating the kitchen staffs about their maintenance of hygiene and handling of food. Okay. So these are the major components which we are going to check. What is the important functions of the dietary services? Next is three important components if I talk about related to is dietary counseling includes the patient with a dietitian. Next is dietary education includes the training of a hospital and kitchen staff related to different medical conditions, and dietary planning and management as per monitor important part of the service department. So these are the basic things which we keep into the mind when we are talking related to the cafeteria. Next is proper disposable, and this is very important thing which we already studied. What is a proper disposable of waste? Okay. So why waste should be properly disposed? Because it is always related to your disease condition. If the waste is not properly disposed, it will cause different type of disease condition into the patients. Okay. So for that reason, the waste should be properly disposed. Give me 2 minutes. So we have studied the basic responsibilities of the different departments. Okay, now we are coming to the most important thing and very important thing related to the hospital management and biomedical waste and how they are going to be get disposed. This is a very important thing. Why it is so? If we don't properly dispose these medical biomedical waste, it will cause different type of first important thing, it will cause a you know different communicable disease spread, it become a source of spread of different communicable disease into the different healthcare professionals. Like the person who is disposing the beast, if they are not aware of the proper or the proper disposable methods will be not followed, so they may suffer from different types of health risks, or it will cause different disease conditions to these persons. Okay, so in many emergency situations, especially into the immediate aftermath of a natural disaster such as earthquakes, cyclones, there may be the dead bodies that require appropriate disposables. Despite many myths and rumors and contrary, exposures to the human body is not itself a serious health hazard expected into the specific masses. Okay, so if I talk about like in cases of COVID, if we are not going to properly dispose those dead bodies or the consumables of those particular patient, it will cause proper disposable. If the proper disposable of those particular things or those dead bodies will be not done, it will definitely become a source of infection and definitely cause the disease condition to the different persons. Okay, other than this, there are a lot of myths also associated with these medical biomedical waste disposable and decreased person. Okay, for example, in many scenarios the management or the cops is based on a false belief that they represent a epidemic hazard if not immediately buried or burned. Okay, so if the dead bodies are not immediately buried or burned, what will cause? They will cause a different kind of disasters. Okay, so these are the different types of myths which has been. But if I talk about more into the logical sense of discussion, why these myths are, what is the reason behind of those myths, okay, why we immediately burn those bodies which are coming from a kind of pandemic or epidemic conditions, because the reason is that it definitely they carry a certain kind of infection, certain kind of virus that is living. Body is dead, but those viruses are living into those particular conditions. Once they enter into the host, another host, they will become activated. So definitely these bodies, these biomedical waste causes infectious diseases, the propagation of infectious diseases. Okay, so this is one of the particular reason. Okay, why we focus on burying and not, because if I talk about dead bodies, but if there are 2 to 3 methods. First is we can release those dead bodies into the water bodies. Okay, so if we are simply use dead bodies like 100, 200,000 people are dying due to any disaster, any medical condition or pandemic condition, if we are uh, dispensing those dead bodies into these rivers or water bodies, definitely it will cause water related disease condition those to those people who are drinking that water, or maybe the disease can be transmitted through a vector. Okay, maybe mosquitoes such as malaria, dengue, all these kind of uh, transfer of disease can be happen because of dead bodies present into the water. Okay, next is pollution. These dead bodies definitely cause the pollution, so they will produce certain kind, when we are burning, when we are decomposing those dead bodies, they will produce certain types of emissions will be done. Okay, certain types of I can say release. If we are burning, there are certain type of carbon dioxide or other gases will be released. If we are decomposing, again there are certain kind of releases will be there. And these, both the way they are reaching into the groundwater level, and again the water is getting infected, the soil is getting infected, so again they were causing a pollution to the environment. Lastly, we have a mental health. Again, the dead bodies to the mental health of a affected population, use that can cause a great impact into the mental health of the people who have survived into that particular phase. So we have a best example of COVID, because something that we have passed recently. So you can see how that particular disease condition has a huge impact on the population. Okay, So again, I can say ki the proper disposable of the biomedical wastes are very important. Okay, one we have discussed is your related to your dead bodies, but other than this, if I talk about, we have different types of medical equipments like syringes, gloves, okay, disposable gloves and scalpels, everything. For example, I'm performing a surgery, okay, I'm using a non-disposable instrument, and the patient has not disclosed the history of HIV or hepatitis to me. I'm using same set of sterilized instrument, and again using that particular instrument into another patient. So might be the chances of transfer of that particular disease through any of the body fluid which is stick on that particular device, or that particular instrument, due to xyz factor, maybe that the healthy person also get if I use same set of diagnosis without sterilization. Okay, second thing, for example, the patient has not tell their history of their HIV or any disease condition, severe disease condition, hepatitis, HIV to the professional, and when they are performing any kind of surgery on that patient, the doctor may got prick, or anything happens, mishappens during the surgery, he or she may get infected, and the that particular device pinches inside their blood. So chances of getting infected or suffering from disease condition uh, from patient to doctor is also possible. Okay, so in these scenarios, that's why the proper disposable are very important of different biomedical products or biomedical waste, so we cannot propagate the disease condition from one patient to another patient. Okay, and to the healthcare persons who is disposing this waste. Okay, so observation can be seen, decomposing or coughs may even more, um, but consequences may be like different kind of potential disease transmission or medical epidemics may be possible. One is your cholera, another is ebola, third is typhoid, and I can say the recent one is COVID. So we have seen since history ki if we are not following the proper protocols to dispose these dead bodies or these medical equipment, it may turn into the propagation of disease condition or infection from one person to another and into the community also. Okay, lastly, we have a mortuary services. Mortuary is a place where we used to keep the dead bodies. Okay, so what all things we have into the mortuary? A reception room, a viewing room, a chamber for the bodies not suitable for viewing, and a room for recording and storing the personal effects. Okay, so these are the different I can say different from chambers where no one can go and view the dead bodies, and a room for records and store of the personal effects. So these are the basic things where we do used to have in the mortuary, and basically we sterilize these areas, disinfect these areas, and properly body dress. Whenever anyone is decreased into the hospital, they will be properly tied up into the proper sheets and white sheets and gauze, and their hand and foot will be tied together. So, and proper disinfectant should be there, and protective clothing should be there, so those who are handling the dead body, so this can prevent the disease